therapist. I've been working in this field since the past 27 years. And let's have an interactive session. So today I'm just going to be talking simply about what are the early signs of depression. Have any of y'all attended the earlier workshops we've had on mental health? Razia ma'am. Anybody else? Okay. So I'll just do a brief recap of what is the difference between sadness and depression. Yeah. Can any of y'all tell me what is the difference between, because we tend to use the term so loosely, you know, I'm depressed, but there is a lot of difference between what is sadness and what is depression. Anybody? No?
I guess sadness is the beginning, is the beginning of going into depression, right? It starts with something sad in your life. You lose your partner maybe, and then you feel that this is the end of the world for you. And little by little you go into depression, I guess, no?
Yes, that is one of the causes, right? Right. That is how it starts. So also sadness is a temporary feeling. It's not permanent. Okay, it's temporary, meaning yeah, you lose somebody close to you, which has happened in COVID. A lot of people have passed away, you know, so there is, you feel bad. I mean, you mourn them for a while, but then you get back to your normal day-to-day activities without it causing a problem in your day-to-day functioning, right? So we might feel sad, we might cry for a couple of days, but then 1 week, 10 days, 1 month ke baad, we'll all get back into our normal schedule. The missing of the person will always be there, but it won't stop us from doing our day-to-day activities, right? So with sadness, so sadness is a temporary feeling which goes away with passage of time. Depression is actually a mood disorder which interferes in your daily functioning. You know, there'll be times when you won't want to get up, you just want to keep sleeping, you don't get sleep the whole night. That is the beginning of depression. So it's, yeah. Any questions? So this is the difference between, because nowadays we have people talking very, very loosely that, oh, I'm depressed, but quite a few of them are not depressed. They are just sad because of the situational happenings, what is happening in the situations around them. Yeah, everybody's got this main difference between sadness and depression. Okay, so now what happens? So when we are sad, it's like a normal reaction to something which is not very pleasant going on, you know, which is not very, which is reaction to difficult times in our life. But sadness goes away with little time. After a bit, depression is a mood disorder that can cause severe symptoms, which may affect how you think, feel, and handle your daily activities, such as sleeping, eating, working. Everything goes for a toss. So it basically starts with, you know, with you losing interest in things which you like to do once upon a time. So supposing somebody is a housewife and who enjoyed cooking, they'll be consistently, she'll feel, I don't feel like cooking, mujhe nahi banana hai, I don't have interest in getting and cooking. So it starts with as something as basic as that. You know, one day, sorry, you know, 1 day, 2 days, if we don't feel like cooking, it's okay. But if it goes on for like a week or something like that, you just are not interested in anything, that could be a triggering factor to depression. Okay, that is one. Secondly, people who get angry, irritated very often, having loud, huge emotional outbursts. You know, so their emotion is normally not appropriate to the situation what they are facing. That is also could be one of the trigger factors that, yeah, you could be getting clinical depression. Changes in appetite, you don't feel like eating anything, or some people when they're depressed eat too much. You know, so the little changes, say supposing somebody has cooked your favorite food, you won't feel like eating it 1 day, you won't feel like eating it 2 days, but when it consistently is happening over 2 weeks, then you need to get alarmed and need to get medical help. Okay, people getting irritated, getting frustrated, getting angry, very difficulty in concentrating, very important. So you, because in depression, you're involved in your own world. You're constantly overthinking. You're reanalyzing. You are so negative. So you're involved in your own world. So you don't end up concentrating on the tasks which are assigned to you. So it affects your work. It affects your mind. It affects your home activities. Many people undergoing who are on the onset of depression start getting absent-minded. So they don't remember daily tasks. They don't remember things what they used to remember earlier, and they put it out. Arey, main to bhul jati hu, main bhul jata hu. So that is also one of the ways in which it starts. Being alone most of the time, like somebody who was very, very jovial, suddenly, like, I'm very outgoing and like people and like company, suddenly prefers to spend his or her time alone in the room all the time. They don't want to come out of the room, of the house, crying without any specific reason. Any small trigger which normally you would have handled in a normal way, you just start crying. Very common. Unable to sleep well at night. So then there are broken cycles of sleep. People are awake late in the night. There's a lot of irritability, lot of overthinking. This is how it starts. Any questions on this? Any feedback? Anybody has faced this? Anybody has come out of it? Anything? Any feedback? Anything? Yeah, Noreen, ma'am.
This is normally the start of dementia, right?
No, it's not the start of dementia. It's depression. There's a lot of difference between dementia and depression. Let's not get into that. Today we are just talking about clinical depression, simple depression.
Because with age, sometimes you forget your regular.
Yes, that you do. Yes, that you do. But if this happens regularly for like 2 weeks along, so this is not the only symptoms. It has to be clubbed with other symptoms also, right?
Okay.
This is one of the symptoms. It has to be clubbed with the other symptoms also for it to be diagnosed as clinical depression. But this is normally how it starts. So you may have 3-4 of the symptoms together. Like, you're crying for long spells without any reason. You're getting angry without any proper trigger, You don't feel like doing anything. You don't feel like getting out of your room. Plus, you're forgetting things. So it all is a cumulative thing. And everything you do within your power doesn't work. Like your family will tell you, come out, let's go out. But instead of going out, you get irritated with them. You get, agitated with them. So it all has to come. It all has to be clubbed together. At least two or three of the symptoms.
So, Husna, will you be covering, I think everybody knows people who have certain amount of depression. Covering what is it, what kind of depression or what kind of symptoms do we start taking professional help by coming to people like you or anybody else?
Yeah, so if any of the, I'll talk about this also, Sunny. So if any of these symptoms last for about 2 weeks or more, that is the time when you need to go and see a professional. So typically how it goes is you go and you see a psychologist, okay, which is somebody like me. So then I would see whether you would require psychiatric intervention, you require some clinical diagnosis or some testing, or it's just something which will just go away with talk therapy. But if I feel that, okay, you might require medication, then the psychiatrist intervention will come in, wherein you would be required to be put on some kind of a low dose of medication along with therapy. So the first step is, if these symptoms last for about 2 weeks or more, is when you need to go and consult a professional.
Can this be done online? Can an online consult be done for depression, or does the person have to meet you physically?
You can do it online nowadays. Because of the pandemic, we are all doing online consultations. Like for 2 years, we've only been doing online. Now we've shifted again to offline mode, but online works as well. So this is mainly how depression starts. I've got patients coming and telling me, we just don't feel like getting up in the morning. We just don't feel like going to work. And you wonder that that sometimes people have everything in lives according to us, but they're still depressed. So sometimes it's also clinical depression is also when there is a chemical imbalance in the brain.
So can I do something, assuming I don't know how many people are comfortable immediately going to a doctor or a psychologist or a psychiatrist. Are there things that a person can do sitting at home to maybe think of trying to reduce their level of depression or their loved one's depression?
Yeah, sure. So if a loved one is going through it, please listen to the loved one. Don't give yan. Because normally people just say, "Arey, just snap out of it, just snap out of it. You're too strong." No, no, it's nothing to do with being strong or being weak. It's just the emotional turmoil the person is going through. So I've got clients who come and tell me, "Arey, but my parents are telling me just snap out of it, but I can't do it." That makes the client feels worse. The person who's undergoing the depression feels worse. Because then again, he starts viewing himself as being helpless. And I can't even do this, because anyways they're thinking of themselves in a negative light. There is also a very strong feeling of helplessness, hopelessness, that nothing is going to go right for me, everything is going to go wrong. So on top of it, if you tell the person, "Oh, just snap out of it," again he starts viewing himself or herself as being helpless. So the thing is, listen to them unconditionally, validate what they are feeling. Okay, fine. But at the same time, urge them to seek professional help, or try to get them out of their comfort zone. That is one other thing what we do for patients who are depressed. So we encourage them to go out, to take a walk. Very important, physical exercise. Extremely important. Even for half an hour, you go and take a walk. You go and take sunlight. Go and walk in the sun. Start slowly by interacting with one friend, then introduce two more friends. Tell them to do one activity of physical self-care every day, one activity of emotional self-care every day, and one activity of social welfare every day. So the physical welfare is a walk, anything to do with your physical. Even so much that for women, we like go to the parlor and get a facial done or get a pedicure done, manicure done, something of that sort. So that is physical self-care. Emotional self-care is, seeing something funny on TV, laughing. So your emotions are getting released. So a lot of my patients enjoy watching this Kapil Sharma show. So a lot of them watch it. So that makes them laugh. Thirdly is social self-care is interact with one new person every day. So this really helps. I mean, just to tide over the depression if they don't want to kind of get medical help. But if it is crossing a level where you think the person is posing a threat to his or her whole life, because sometimes with depression, you get a lot of suicidal thoughts, which are very difficult to control. Then the person needs medical help ASAP.
So Husna, if assuming I think I have depression, can I do something by myself to get better? I understand that there is social, but a lot of times I myself may not be able to, will myself in that situation. What does one do then?
So depression, the client has to push himself to get out of the comfort zone. That is what you can do. Okay, but agar nahi ho raha hai, then you need somebody to push you. You need to cut off your negative thoughts. Depression is also regret about the past. Normally, it's ruminating over the past. Anxiety is worry about the future. But normally what we've seen is people who are undergoing severe depression. Okay, it is very difficult for them to snap out of it on their own. They definitely need help. If you have a good support group like friends, you can urge them to push you. Interact with them, tell them what you're going through. Here, they can listen to you and they can help you accordingly.
Anybody has any questions, please unmute yourself and ask Husna.
Yeah, please ask any questions.
Ask you one question that sometimes the family atmosphere also gives some type of irritation in life.
Sorry, your voice, I can't hear you.
Family irritation is always put us in a very difficult position.
I can't hear you, ma'am.
Srinati, are you saying that sometimes family irritation can put you in a bit of a problem?
When causes anger and
Srinati, we can't hear you. I think the background noise in your is going on.
Work going on.
Okay.
Pause. Still.
So Srinandi, what we'll do is, we can't hear your question. If you can just write it to us, I will send it to Husna and I'll get her to answer it separately. Is that okay?
Already. Thank you. I'll do that.
Thank you. Anybody else?
हेलो,
Yeah.
जो मेरा कहना ये है कि जो डिप्रेशन में है तो वो तो कुछ करना ही नहीं चाहता ना,
Exactly.
तो वो खुद तो अपने आप को बाहर नहीं निकालेगा बल्कि वो और अंदर ही अंदर जाना चाहता है।
Absolutely.
हाँ, क्योंकि वो कंफर्ट जोन में रहना चाहता है ज्यादा से ज्यादा, तो उसके इन-लॉ, उसके जो आसपास लोग हैं, फ्रेंड्स या फैमिली मेंबर, वही कुछ कर सकते हैं उसके लिए।
हाँ, वो ही कुछ कर सकते हैं। Exactly. वही मैं बोल रही थी कि जो डिप्रेशन में बंदा रहता है वो तो अंदर ही रहता है, उसको तो कुछ करने की इच्छा नहीं होती है, राइट? तो अगर आप देख रहे हैं कि वो इतना डिप्रेशन में है, देन आपने सब कुछ किया, फैमिली फ्रेंड्स ने उसको बाहर निकालने की कोशिश की, वॉक के लिए लेके गए सब, लेकिन अगर तो भी कुछ फर्क नहीं पड़ रहा है तो तब उसको प्रोफेशनल हेल्प की जरूरत पड़ेगी। आप समझे?
कोई आइडिया कि हम उसको तैयार कर सके, बाहर ले जा सके, जैसे वॉकिंग को जाना है, वो वॉकिंग को भी आने को तैयार नहीं है।
हाँ।
स्टोरी सुनाना चाह रहे हैं, हम तो स्टोरी सुनने को तैयार नहीं है, नहीं मूड नहीं है, मुझे नहीं सुनना है, इंटरेस्ट ही नहीं ले रहा कोई चीज में। तो कोई ऐसा आइडिया बताइए आप कि हम किसी को ये कर सके।
आपने सब कुछ ट्राई किया? हाँ, इट्स नॉट वर्किंग, राइट?
हाँ,
आपने सब कुछ ट्राई किया, वर्क काम नहीं कर रहा है उस पे, राइट? हाँ,
yes.
तो अगर आपने सब कुछ ट्राई किया, उसको बाहर निकालने की कोशिश की, उसके साथ में टाइम स्पेंड किया, उसको आप स्टोरी बोल रहे, वो नहीं सुन रहा है, मतलब ये आपके बस की बात अब नहीं रही है। इसको प्रोफेशनल हेल्प की जरूरत होगी, चाहिए ही, ये जो भी सफर कर रहा है, क्योंकि आपने तो सब किया, यू हैव पुश्ड हिम,
ओके,
राइट? So you need to take him to a psychiatrist or to somebody like someone like me who will talk to him, देखने को कि actual problem क्या है उसका। Otherwise आप लोग उसको और पुश कर सकते हो, लेकिन क्या होता है कभी-कभी क्या
एक्चुअली है ना, वो ये समझता है कि अगर मैं डॉक्टर के पास जा रहा हूँ तो मैं पागल थोड़ी हो गया हूँ, मैं क्यों जाऊँ,
वही प्रॉब्लम है। अभी देखो,
आने को भी तैयार नहीं होते खुद।
नहीं, देखो अभी एक चीज देखो, जो माइंड है वही प्रॉब्लम है लाइफ में। जो माइंड है ना, वो बॉडी का सबसे इम्पोर्टेंट पार्ट है। ओके, अभी हमारा पेट दुखता है, हम तुरंत भाग के जाएंगे डॉक्टर के पास। ओके, हार्ट का प्रॉब्लम रहेगा तो यू विल गो टू द डॉक्टर। ब्लड प्रेशर हाई हो जाएगा तो तुरंत आप लोग डॉक्टर के पास जाते हो। ओके, अब जब ब्रेन इज सच एन इम्पोर्टेंट पार्ट ऑफ योर बॉडी, इफ द ब्रेन डजंट वर्क, नथिंग इन योर बॉडी विल वर्क। तो उसके लिए डॉक्टर के पास जाने को क्यों आपकी झिझक है?
नहीं, वो ठीक है, ऊपर वालों को सबको समझ रहा है, मगर उसको ये बात नहीं समझ रही है। वो बोलता है कि क्या मैं पागल हूँ, ऐसा समझता है कि मुझे पागल समझ रहे हैं।
तो आप उसको नहीं, तो आप उसको ऐसे समझाइए कि जब हमारा पेट दुखता है हम जाते हैं डॉक्टर के पास, जब आपको बुखार होता है हम डॉक्टर के पास जाते हैं, राइट? जब हमको बीपी मेडिसिन लेना पड़ता है हम लोग लाइफ लॉन्ग लेते हैं बीपी मेडिकेशन, राइट? तो ब्रेन इज ऑल्सो पार्ट ऑफ योर बॉडी, राइट? अपने बॉडी से अलग है क्या ब्रेन? नहीं है, राइट? बॉडी ब्रेन का पार्ट है। तो अगर ब्रेन जो बॉडी का ही पार्ट है उसको आप ध्यान नहीं दे रहे हो तो कौन आपको पागल समझने वाला है? आप उसको ऐसे समझाइए कि बॉडी के जो इलाज के लिए तो हम जाते ही है डॉक्टर के पास। तो इट इज नॉट दैट देयर इज समथिंग रॉन्ग विद यू, इनफैक्ट अगर आप ट्रीटमेंट लोगे तो आप जल्दी अच्छे हो जाओगे।
हाँ, कठिन है, मगर कठिन है उसको ले जाना।
कठिन है? कौन है ये, आप शेयर करना चाहोगे? कौन है ये?
नहीं, कोई है नहीं, एक बता रही हूँ मैं, एक मेरी फ्रेंड थी, तो उसके बहुत कोशिश करी मैंने कि वो डिप्रेशन से बाहर आए। शायद आपने बात भी की है ना वो डॉक्टर कौसर से।
हाँ, मैंने बात की उनसे।
हाँ, अभी उनसे आपसे बात भी किया है, तो अभी ठीक है वो। अभी ठीक, इसलिए
तो कहाँ है डॉक्टर?
अभी वो धुलिया से अभी पूना आ गई है।
अच्छा, आ गए पूना?
हाँ, तो उसको मैंने बहुत ट्राई की थी, इधर उधर ये तारा सोशल पे लाने की कोशिश की, तो वो रेगुलर नहीं आई, कभी आती कभी नहीं आती। मगर वो अभी फिलहाल उसके लड़के ने उसको धुलिया से अपने पास लेकर आया है, इसलिए वो अभी खुश है, अच्छी है।
वेरी गुड, ओके, गुड।
But Husna, actually, Razia auntie has actually asked a very interesting question. Let me ask it in a different way. Let's say I am the person who's, who people are suspecting is depressed, and I do not want to see a psychologist, psychiatrist, even a GP. What do you do? I know that you say that convince me to do that, but what else can I do? Can I get a psychologist, or can I get a person like you to come to my house?
Yeah,
And
so there are people who do home visits.
no, but I know there's a lot of stigma attached to it. I know it's all wrong, but how does one get a person to see a doctor without telling him or her that you're seeing a doctor?
No, you cannot do that because no doctor will see you without the patient's consent.
It's not possible, right?
It is not possible. No doctor will see you without the patient's consent. And especially now, even in earlier, it was not so in India, but now in India, the laws have become very strict. Nobody will see you without the patient's consent. Even when I get people who I feel that they require medication and they are not ready for medication, I don't even see them after that. I don't do therapy with them if they don't take medication, if it is required. So there are many patients who come, but when they say medication, they say, "Nahi, I have therapy karo," I stop seeing them immediately.
Okay, and this is important actually.
Yeah, so the patient, it has to be done with the client's consent.
Any other questions?
That's how most of the ethical psychiatrists and counselors work. Huh?
No, that actually makes sense, right? I mean, you want to heal yourself. That's only when you should go to a doctor. Else you're just going for the head. You're not going.
Yeah, so I've got clients in 3 sessions after suffering from severe depression without medication. They've been okay because they've worked on themselves. On the other hand, there are clients for 3 months. They don't want to work on themselves, so they're stuck where they were.
Completely different question. Is something like travel or hobbies good for people suffering depression, or is it too ambitious?
No, it's very good for people, no, when they suffer from depression. That is one of the things we tell them to start doing, to start doing things what they used to enjoy.
Okay.
But when they undergo depression, when they are just beginning to, get through the whole cycle of depression, this is the first thing which comes up. Things what they enjoyed doing earlier, they have no interest in them at all.
Okay. Are there any ways online where somebody can test themselves for depression?
No. So none of the online tests are reliable. I wouldn't promote any of them. You need to go to a proper qualified clinical psychologist who will do the proper assessment and then tell you.
Okay. Husna, if anybody has any other questions, please ask. Or else, can you take us through how a typical? I know that every case is different. How a typical therapy for depression for a potential patient would happen? Like he would or she would set up an appointment with you. What would be an approximate kind of a conversation with you? How does it work? I think a lot of people will never have been to a psychologist before in their lives, right?
Okay, so anybody has a question before I start this? Any? No questions today. This is a very quiet group.
Very quiet group.
Yeah, I know. No questions.
You've got them speechless, Husna.
I think so. Nobody's talking.
Okay, so can you? Yeah.
So do I start? So
Yes,
when
please.
the client approaches me, so somebody will either give a reference or something like that. So typically the client would tell me that, okay, I need an appointment set. Yeah. So what I normally start working with is what is bothering you the most, what is happening right now, instead of going into the past immediately, because definitely the past has an effect on your present 100%, and it will have an effect on your future. But in the first 5-6 sessions, there's no point in discussing the past because the present is somewhere linked to the past. So the therapy I do is I bring the patient down to the present, ask the patient what are the existing symptoms, what is happening currently, what are you going through, what is happening in life. Start working with the issues presently, so he's feeling better, he or she is feeling better. in like 2-3 sessions, and then slowly we get into the past if there is something. Also, I give the client homework to do, which the client has to do regularly. So if I tell the client typically that you need to go down for a walk, the client has to go down for a walk every day. And he messages me that, I've gone down for a walk. If I tell the client, okay, you need to say this to yourself, you need to write this down, the client is expected to do it. So the harder the client works on himself, the faster results do we see. That is how a typical therapy session works. Whatever is discussed between the therapist and the client is completely confidential. It is completely non-judgmental also.
And Husna, is there any kind of evidence that any particular gender is more prone to depression, or are both the genders equally prone?
See, according to research, they say women are more prone, but in my practice, I see a lot of men coming forward now for therapy. A lot of men coming forward for therapy. In fact, most of my clients are men rather than women. So normally they say women because of the hormone, the whole menopausal thing, and all that. Childbirth se bhi kabhi kabhi ho jata hai depression, but I have seen equal number of men also. Only thing was men used to not talk about it. Now men are more open and talking about it.
Husna, what happens when depression is caused because of physical inability, like your inability to walk or consistent pain, or basically what you are used to doing, you cannot do because of a physical limitation?
Yes.
What is there any different way of handling that?
Yeah, there is a different way, no? There is a different way. See, everything has a cause and effect, right? So then the patient is taught to kind of, if you're 80, whatever, you have a physical ailment and you can't walk because of that, and you're depressed because of that, right? So the patient is taught coping strategies and mechanisms, how to kind of cope with that situation. And for every client, it is a different coping mechanism, depending on the specifics of the case.
Any other questions for Husna? This is actually the quietest session we've had yet.
Yeah, I know. I'm also surprised because normally people are talking so much in the session.
I think,
come on, no questions.
I think if there are no other questions, we can, we can summarize and we can end. Are there any questions? No. So, Husna, would you want to just summarize again the basic, signs
Okay,
of...
we'll ask somebody from the audience only to summarize it. Chalo. Who's summarizing for me? Who heard well?
Doctor, I have one question.
Yeah, sure. Tell me, please.
Are the depression patient given medicine to sleep, like Restil or something?
That depends on what the psychiatrist decides.
And is it safe to have like for a long time, like 6 months, 1 year?
Yeah. Because they're monitored constantly by the psychiatrist.
And if the person is taking medicine for depression, can they plan for the kid or no?
See, that you have to check with the psychiatrist. Depends what medication, what dose you're getting, what dose you're taking. So that depends with the psychiatrist. So if you have a good ethical psychiatrist, he will tell you, he'll put you on a minimal dose, he'll ask you questions, he'll psycho-educate you before you take it.
Okay. Okay, doctor. Thank you so much.
Welcome.
You want to just quickly talk about, I think, an interesting question again. You want to talk about the difference between a psychologist and a psychiatrist?
Okay, so a psychiatrist is a doctor who gives medication for a mental illness. So if you have depression, if you have anxiety, and if the doctor or any other mental illnesses like bipolar, schizophrenia, whatever, then the psychiatrist will give you medication. A therapist and a psychologist will not give medication. Psychologists either will do clinical testing or they do therapy without medication to help you get better. That's the primary difference between a psychiatrist and a psychologist.
Any other questions? I think as a teacher, I think everybody, there's so many teachers on this group, and when they get asked to summarize and answer, I can see them all hiding.
Who are the teachers? Who are the teachers?
I think we're all taking revenge, Husna.
I think so. Who are the teachers here?
I can see one principal. I can see one teacher. I can see two teachers. I can see three teachers.
Wow.
They're all hiding right now.
Come on, teachers, summarize. Who's going to summarize?
I think we should end the session. If you could just quickly summarize on the earlier stages, and then I think we should summarize. We should end.
Okay, so we started with what is the difference between sadness and depression. Then we went on to the symptoms of early depression and what you can do to help a person cope with depression, whatever is within your means. And if you've tried everything and nothing has helped, then it is most important to refer the client, the person to a professional. That just kind of just sums it up, I think. And of course, last maybe did the difference between the psychologist and the psychiatrist.
Thanks, Husna. Any questions? Thank you very much, Husna. We need to have you back again. I think the last few sessions that we did a few months ago, actually, looking at the number of hits we had, a lot of people were interested. We should do that again.
Yeah, I think so. Yeah.
Yeah.
Thank you, everybody.
Thank you very much. And
thank you, Husna. Thank you very much.
Thank you. Hope you all benefited. Thank you.
Yeah.
Bye.
Bye.
Bye.